Hello, I'm Steve Morrison, Senior Vice President here at the Center for Strategic and International Studies in Washington, D.C. We're joined here today by Dr. Julie Gerberding, Executive Vice President for Population Health at Merck & Company Incorporated. Julie, thank you so much for being with us here today and for joining this conference on cervical cancer. If you could start by just recounting for us what has been achieved in your view, what has been achieved since 2006 when the HPV vaccine first became available for wide-scale use globally. If you could, from your viewpoint, summarize for us, what has this meant?
You know, I think the most amazing thing is that in less than 10 years, we have approval for using this vaccine in 65 countries around the world, in some of the poorest countries,
Yes.
In terms of what's happened through the Gavi initiative and so forth. So we are now reaching more and more girls, and in some countries boys too, with the protection they need for HPV-related cancers. We also have, at least from a Merck perspective, we've distributed about 185 million doses of vaccine. So that's a pretty important statistic when you translate that into cases of cancer prevented.
Yes.
But of course, we have a long way to go, and where we need to go next is to really look at coverage. So it's one thing to have the vaccine and have it available. It's another thing to actually effectively cover the population so that you really get the full benefit of the program.
So when you look out for the next 5 to 10 years in this next phase, what needs to happen in order to move to the next phase in a very dramatic way? And what do you see as the essential next steps?
Well, I imagine the opportunity to really move toward elimination of cervical cancer. And in order to do that, we must achieve much broader based vaccine coverage in all countries.
Yeah.
But we also need to utilize the inexpensive means of screening and to make sure that we have treatment available for those women who screen positive. So it isn't enough just to prevent infection in the young girls. We have to also remind ourselves that if we don't deal with the people who are already infected, about 265,000 of them will die every year.
And say a bit about bringing the message across to a world community that may be ready to receive the message, but it's also a noisy world. You have anti-vaccine interests, you have misinformation or misunderstanding. We see this here in the United States, where our uptake is about 1/3 of adolescent girls, and there's an effort to sort of improve on that here in the United States. What's the messaging, in your view, that's going to be most effective at convincing parents and who may be anxious or concerned to move ahead, to get the coverage rates here up? Because here's a readily made tool in an advanced economy. What's the message in your view?
I think the message is simple. This is cancer prevention. We don't have many better tools than this to prevent cancer, so why would you ever not want to protect your child from cancer? And I think on a broader, more social scale, the message is women are valuable. Women are valuable in all societies, and that protecting them against needless suffering and death is something that all good societies should prioritize.
Well, thank you so much.
You're very welcome. It's my pleasure.